নমস্কার, বাংলা জাগোয় আপনাদের স্বাগত। ভাস্কুলার প্রবলেম কি এই সমস্যা এবং কারা কারা রিস্ক জোনে থাকেন? ট্রিটমেন্ট অপশন কি একমাত্র ভাস্কুলার সার্জারি এবং এই সার্জারির মাধ্যমে কতটা নিরাময় সম্ভব, সেই সমস্ত কিছু আমরা জানবো। আজকে এই মুহূর্তে আমাদের স্টুডিওতে উপস্থিত রয়েছেন অ্যাপোলো চেন্নাইয়ের সিনিয়র কনসালটেন্ট ভাস্কুলার সার্জন ডক্টর ভি বালাজি স্যার। ওয়েলকাম টু আওয়ার শো। এবং আপনাদেরকে জানিয়ে রাখি, অ্যাপোলো হসপিটাল চেন্নাই যা গ্রাহামস রোডে, সেখানে এক ছাদার তলায় কিন্তু আপনারা সমস্ত রকম পরিষেবা সেখানে পেয়ে যাবেন চিকিৎসার ক্ষেত্রে। এবং হেল্পলাইন নম্বর 0440401066 এবং হোয়াটসঅ্যাপ নম্বর 8017363636 এবং 9163048748 এই নম্বরে আপনারা যোগাযোগ করতে পারেন কোনো রকম সমস্যার ক্ষেত্রে। এবং একেবারে আধুনিক চিকিৎসা পরিষেবা কিন্তু সেখানে পাওয়া সম্ভব এবং আন্ডার ওয়ান রুফ। আমরা এই বিষয় নিয়ে এবার মূল আলোচনাতে ঢুকবো। স্যার, লেটস स्टार्ट विद सम बेसिक क्वेश्चन। वास्कुलर प्रॉब्लम मीन्स नसों का कुछ प्रॉब्लम, तो ये वास्कुलर सर्जरी से क्या क्या ट्रीटमेंट हो सकता है?
ठीक है, तो vascular problem means throughout the body we have blood vessels. Two types of blood vessels है, arteric है, vein है. Artery means it's a good blood vessel. हार्ट में आर्टरी आ रहा है, पूरा बॉडी के चल रहा है, ये आर्टरी है. Vein means it carries bad blood vessel, that is from throughout the body goes to the heart. Two types of blood vessels. Whatever disease, बीमारी का blood vessels का बीमारी का ट्रीटमेंट के लिए vascular surgery है. There are different types of problems which can happen in vascular problem. आर्टरी का ब्लॉक हो गया, खत्म हो गया, ये आर्टेरियोस्क्लेरोसिस का TAO प्रॉब्लम आ रहा है, बोर्जेस डिजीज आ रहा है, तो अथेरोस्क्लेरोसिस ब्लॉक आ रहा है. वेन के लिए कॉमन प्रॉब्लम वेरिकोस वेन आ रहा है, थ्रोम्बोसिस, डीप वेन थ्रोम्बोसिस आ रहा है. So all these problems called vascular surgical problems treated by specialist vascular surgeons.
ओके, मतलब ये आर्टरी एंड लिम्फेटिक एंड वेन, ये छोड़ के मतलब आर्टरी ब्लॉकेज हो, वेलकोस वेन हो, ये छोड़ के और कौन कौन सी बीमारी है जो इस सर्जरी से कवर अप होता है और क्या क्या कवर नहीं होता है?
आर्टरी का प्रॉब्लम, मेन प्रॉब्लम ब्लॉकेज, पेरिफेरल वैस्कुलर डिजीज और बोर्जेस डिजीज और TAO. ट्रीटमेंट का डिफरेंट ऑप्शंस है. Main treatment for peripheral vascular disease now we have what is called endovascular therapy और keyhole surgery है. पुराना में बहुत बड़ा open operation करना है, अभी keyhole surgery possibility है. Endovascular therapy means passing a small wire, like how for heart they do angioplasty stenting. आर्टरी का, लेग आर्टरी का possibility है, balloon treatment possibility है, stent possibility है. Same thing for the hand, for even stomach possible है. This is called endovascular therapy. So same thing, artery problem, aneurysm आ रहा है. Aneurysm मतलब वो पाइप के बड़ा हो गया, it is become bigger and bigger. So if it becomes bigger, it can burst और rupture हो गया, लाइफ के बहुत ज़्यादा प्रॉब्लम है. So this kind of aneurysm can also be treated by endovascular therapy. Nearly 80 to 85% operations are done by endovascular therapy now.
ओके, सो दिस aortic aneurysm जो आपने अभी बोला, उसका भी मतलब ये ऐसे प्रॉब्लम का भी ट्रीटमेंट ये सर्जरी से होता है. सो दिस सर्जरी इज द ओनली ऑप्शन फॉर दिस प्रॉब्लम.
Aortic aneurysm means main pipe, हार्ट के बड़ा पाइप आ रहा है, खून का पाइप aorta है. नॉर्मल साइज लगभग 1 सेंटीमीटर 1.2 सेंटीमीटर है. धीरे धीरे बड़ा हो गया मतलब aneurysm है. So people having blood pressure problem, smoking problem, or even what's called atherosclerosis problem, these blood vessels can become bigger and bigger. Very common Western countries का, Indians का थोड़ा कम है, mainly because age population. Western countries का elderly population बहुत ज़्यादा है, India का थोड़ा कम है. But still aneurysms can happen in India also, because this is a very important problem. If you don't diagnose early, it can rupture. Rupture means patient cannot be saved. So the treatment option is only intervention. Intervention means it can be an open operation or endovascular aneurysm repair, what's called a EVAR or TEVAR. So again, options of without operation, stenting can also be done for aortic aneurysms to save the life of the patient. But not all patients require procedure because it all depends on the size and what's called a growth of the aneurysms. So what is the size of the aorta has to be measured clearly by a CT scan, and then you can do the treatment properly.
And iska success rate kitna hai?
This is the excellent technology now available in India now. So almost 99% of the patients can be saved by endovascular procedure. Open operation maybe about 5% complications or so, but endovascular almost 100% patients can be saved without cutting, so patient can go home within 2 to 3 days.
Okay. Diabetic foot, we heard about it. Exactly क्या problem होता है and इसका treatment में क्या है?
See, India is capital of diabetes. So nearly 1 to 2% of the population are diabetic population now. So that means if you look at the adult population, nearly about 10 to 15% of the population are diabetics. So diabetics का अभी अच्छा medicine है, insulin है. So these population, diabetic populations live longer and longer. So complications mainly can happen in the leg. There are 3 types of problems which can happen in diabetic population in the leg. That is called diabetic foot problems. Mainly, number 1 is sense neuropathy problem आ रहा है. Sense का कम हो रहा है धीरे धीरे. So patients can damage the leg without the knowledge. So patients who has been diabetic for more than 10 years, 15 years, the leg sensation goes down. So when they are walking without the knowledge, small stone or nail can prick and it can become an ulcer or infected. So second problem is what's called a diabetic foot infection. As you know, diabetic patients can pick up infections very quickly. Their healing capacity is poor. So whenever there is any damage to a scratch in the leg, they can pick up infection. Third, most importantly, is the vascular problem. If there is no circulation to the leg, which is very common in patients with the long-term diabetes, they can also have diabetic foot problems. So all 3 in combination or alone can cause diabetic foot problem. If it happens together, they have very high risk of losing the toe or the leg. These are the patients what we call a very high risk of losing the leg, amputation. So this has to be prevented by proper knowledge given to the patient, proper message has to be given to the patients.
Okay. तो ऐसे हमें बॉडी के ऐसे कुछ सिग्नल देता है जिससे पता चले कि हमें ऐसे कुछ वास्कुलर प्रॉब्लम है?
Very important question, because patient has to know when the vascular problem is coming, what are the complaints he can get. This is very simple. For survival of any tissue, blood is required because blood carries all the nutrition, oxygen. For example, leg circulation carries blood to the muscles, which is helping you in walking every day. So if there is no blood vessel to the muscle, patient cannot walk. Patient who was walking 2 kilometers before, he cannot walk even 500 meters because there is no blood supply to the leg. So first symptom is pain on walking. A patient का चल रहा है पैर का, mainly muscle का पैता आ रहा है, so pain का बहुत ज़्यादा आ रहा है, so patient has to stop. So this is called claudication, which is classical of vascular disease. Next, when there is still worse problem, the circulation, color, वो पार के काला धीरे धीरे काला हो गया, वो गैंग्रीन आ रहा है. गैंग्रीन मतलब पूरा उंगली मर गया, वो पाँव के मर गया. So this is a very dangerous situation.
And there is no sense as well.
Correct.
Okay.
Because when there is no circulation, there is no sensation. So when there's pain, patient has to come to the doctor immediately. Patient has to see the specialist immediately. Only then we can treat. When it starts changing color, it is too late, or at least then emergency treatment has to be started.
Okay. तो ऐसे कुछ प्रॉब्लम लेकर जब पेशेंट आते हैं, जब वो डायग्नोसिस प्रोसेस स्टार्ट होता है, क्या क्या टेस्ट करना पड़ता है उसको?
Testing these days is very simple. All diabetic patients should have what is called regular surveillance. Like how diabetes people go for a regular blood checkup, they should have a leg checked up, they should have the eye checked up, they should have a kidneys checked up regularly, because these are the complications can set up. For the leg, we have what is called a Doppler test, which is a simple ultrasound test, which can be done as an outpatient. It takes only 10 minutes. Leg blood circulation can be clearly mapped to see how much of problem. So when the patient comes with leg pain with diabetes, we do this Doppler to diagnose vascular diseases. And if it is a serious problem, then we go on to do what's called a angiogram, what is called a CT angiogram or MR angiogram. Patients with diabetes can have kidney problem also. So in these patients, to avoid kidney damage, we do MR angiogram. With this, we can find out what exactly is a blockage, where is a blockage, and what is the treatment plan can be, which can be discussed with the patient immediately.
Okay. तो रिस्क जोन में मतलब कौन सा एज का पीपल होता है एंड जब ऐसे कुछ प्रॉब्लम लेके आपके पास आप लोगों के पास आते हैं तो मेनली क्या ऐसे कुछ लाइफस्टाइल रीजन है जो रेस्पॉन्सिबल है उसके लिए?
Risk factors for vascular disease, it is usually the age, as you rightly said, elderly population, but our population, diabetes happens very early, smoking also happens very early. So these are the two major risk factors for developing vascular problem.
Okay.
Smoking, diabetes, blood pressure, hypertension, cholesterol problem. Then if there is a family history of any diseases, it can be heart attack, stroke. These problems, these patients can develop vascular disease. And this is in combination, diabetes, smoking, blood pressure. Patients develop this vascular disease when they are very, very young. So you need not be 70-year-old to develop a vascular disease. Even a 45-year-old, 50-year-old also, we see these days, because young people start smoking very early, and this can damage the blood vessels very quickly. So these are the patient has to be seen by a doctor very quickly.
Okay, so lifestyle modification can helpful.
Absolutely. The first way is to prevent the disease. What are the lifestyle modification? For example, if you're a smoker, you have to stop smoking immediately, whether you have a vascular problem or not, because smoking can affect any part of the body. If you have diabetes, see a doctor regularly. Make sure your diabetes is controlled properly. And if you have problems otherwise like blood pressure, cholesterol, etc., these are the things which has to be monitored regularly. And other thing mainly is weight. If you are overweight, that also contributes to all complications including vascular disease. So weight has to be reduced. How do we do that? We have to be very strict with our diet. You have to be careful in diet, modify your diet accordingly, and do physical exercises. Even if you have a vascular problem, we advise the patients to go for walking regularly. Walking helps to develop circulation more and more, not only to reduce the weight, reduce the cholesterol, reduce the diabetes, it also increases the circulation. So diet control, reducing the weight, going for a walking every day, minimum 20 minutes to 30 minutes, will help patients both prevention of vascular disease as well as in treatment of vascular disease.
So regular exercise is needed.
Definitely for all kinds of patients these days, because the our
due to sedentary lifestyle.
Because of the lifestyle, patients, your food habits and work habits, your stress at work, you have very high chance of developing any kind of vascular disease. Vascular disease means not only peripheral vascular disease, you have a risk of developing heart disease, stroke, etc. And by changing your lifestyle, you can prevent, or modifying your lifestyle, you can prevent all kinds of problems in your life.
Okay. So vascular surgery, how much it is effective for the cardiac attack patient?
See, this is a combination of problem. Blood vessel is a blood vessel in any part of the body. So when there is a blood vessel affected in the leg, we assume there can be a problem in the heart. When there is a problem in the heart, we think there is a problem in the brain, in the leg also. So there is a combination of factors, what is called a cardiovascular diseases. It is not just cardiac disease, cardiovascular diseases. So when there is a patient with severe leg vascular disease, we have to rule out any cardiac disease also. So these are all like combination of factors. Because when you're starting the treatment, we can start the treatment together for both heart disease as well as for the leg disease also.
And how much smoking is responsible for both men and women?
Smoking is one of the very high risk factor for developing any vascular disease, both in men and women. Men usually they are what's called high smokers, so they smoke very high levels of tobacco, we calculate what is called a packet years. If you're smoking 1 packet a day, that is over a period of time that accumulates, that's 1 packet a year. If you're smoking 2 packet a day, so within 6 months it becomes 2 packet a year. So depends on how much you smoke. Women, to a certain extent, they are protected by their female hormone, that is estrogen, until premenopause. Postmenopause, they are also at very high risk of developing vascular disease, especially with combination of diabetes. So after a certain stage, both men and women are at high risk if you are a smoker. So smoking with, especially, it can be any form of tobacco, not just smoking. It can be tobacco chewing, it can be sniffing. Any form of tobacco is injurious to a vascular disease.
Okay. So what is RF treatment?
RF treatment is one of the latest technologies which is available for the leg varicose veins. Varicose veins, as you know, is a very common problem. Varicose veins is nothing but weakness of the veins in the leg. So you commonly see a lot of patients walking on the road with bulging veins, what is called varicose vein. So easy treatment for this is endovenous radiofrequency ablation, EVRFA, which is done by a bit of local anesthesia and by minor anesthesia. Within 1 or 2 hours, patient can go home without any side effects. The results are excellent. We can easily give up to 100% results, and it is a very quick recovery, and the results are excellent with this procedure.
Is there any side effect of this treatment?
Usually not. Very rarely we have some complications because of this procedure. Even that is very minor. This happens mainly in patients who presents very late, because when patients come with advanced stage of the varicose veins, like ulcer, bleeding. So these are the patients who can have some minor complications. Mainly complications are what is called a phlebitis or pain. Otherwise, 99.5% of the patients go home comfortably, very safely, without any complications.
Okay, now most important, vascular problem से बचने के लिए अपने नसों का ध्यान हम कैसे रखें?
Advice. Main advice for varicose veins or any vascular problems. One, prevention is always better than cure. Stop before it comes. Stop before it hits you. So, patients at risk of developing the problem, mainly sugar patients, smoking patients, BP patients, cholesterol patients, overweight patients. You have to be careful so that you don't develop any vascular problems. So if you have all these problems, make sure you control it, you prevent it, and you don't develop these complications. If you have any problems, go to a specialist immediately who knows about the problems. For example, leg pain can develop in any other disease also. For example, your knee can have a knee pain, your back pain can come to the leg causing sciatica pain, but if you have a vascular pain, you have to go to a vascular specialist, so there is no delay in the treatment, so treatment is given appropriately at the right time, so that we can prevent complications. Mainly, our aim is to prevent limb loss or amputation. This is our aim, our theme. All the vascular surgeons are working hard throughout the country to prevent what is called amputation. In India alone, there are about 1 lakh patients who lose their limb, that is amputation, every year. And unfortunately, out of all these patients, 80% can be prevented if they seek their specialist help very quickly. So if the patient's knowledge is better, I think the limb losses also can be reduced. So the main message is, you have a problem, if you think you have a vascular problem, please see a specialist immediately, quickly.
And what type of facilities we can get at Apollo Chennai Hospital?
As you know, Chennai has been a forefront for all the technological innovations. Even in vascular surgery, we have all the technology machines available. The main advantage is patient safety and the results. If you have a higher technology, the safety of the patient gets better and the results are closer to any of the Western standards. In fact, I can say our results are better than any Western standards of the hospitals. So, if you have any problem, seek the specialist's help immediately.
থ্যাংক ইউ স্যার ফর শেয়ারিং অল দিস ইনফরমেশন।
Thank you.
আমরা কথা বললাম ডক্টর ভি বালাজির সঙ্গে, এবং ভাস্কুলার প্রবলেম যে ধরনের সমস্যা আপনারা শুনলেন, শরীর কিন্তু কোথাও না কোথাও জানান দেয়, কিন্তু আমরা কিছুটা হলেও অবহেলা করি। সেটা একেবারেই উচিত নয়। এই ধরনের কোনো সমস্যা, কোনো উপসর্গ যদি দেখা দেয় তাহলে তৎক্ষণাৎ কিন্তু চিকিৎসকের পরামর্শ নেওয়া উচিত। এবং আরও একবার বলবো, অ্যাপোলো চেন্নাই হসপিটালে সেখানে কিন্তু সমস্ত রকম চিকিৎসা পরিষেবা, একেবারে আধুনিক যে অ্যাডভান্স ট্রিটমেন্ট রয়েছে সেই সমস্ত কিছু আপনারা সেখানে পাবেন। এবং হেল্পলাইন নম্বর 0444040166 এবং হোয়াটসঅ্যাপ নম্বর 8017363636 এবং 9163048748 এই নম্বরে ফোন করেও আপনারা যোগাযোগ করতে পারেন, বুকিং করতে পারেন। আজ সময় শেষ, আজ এখানেই শেষ করছি। নমস্কার।